Hello, and welcome to the Total Joint Patient and Family Workshop here at Tufts Medical Center. We thank you for choosing to have your total joint replacement surgery performed at Tufts Medical Center. Please be assured that our chief concerns are for your well-being and an excellent outcome. In addition, we are committed to making your entire experience with us as pleasant and seamless as possible. In order to help you prepare for your surgery, we have put together this online workshop for your viewing. Please watch this class in its entirety and encourage family and friends who will be assisting you after surgery to watch as well. This class will review the following topics: your pre-operative visit, what will happen day of surgery, an overview of the anatomy related to joint replacement, what to expect in the post-operative course, the importance of fall prevention. Physical therapy and occupational therapy will discuss rehabilitation after surgery. Case management will review discharge planning. A nurse educator will discuss nursing care related to your surgery. We will begin with the pre-operative visit. This visit is scheduled when you book your surgery date and clinic. You will come to the center for preoperative assessment approximately 3 to 4 weeks prior to your elective surgery. The goal is to identify and address in advance any issues or risk factors that may cause problems during or immediately after your surgery. The appointment is located in the South Building on the 5th floor. The appointment itself takes approximately 45 minutes. Here you will meet with a nurse practitioner from anesthesia. There will be a review of your medical, surgical, and anesthesia history. They will explain how anesthesia will be used during your surgery and answer questions you may have. You may also have your blood drawn, as well as an EKG, an electrocardiogram to check your heart. If necessary, additional testing may be performed. These tests allow the team to be proactive in detecting and addressing issues that could delay or even cancel your surgery. If you see a specialist, such as a cardiologist, endocrinologist, pulmonologist, etc., you should contact them and let them know of your upcoming planned surgery. You will need a letter of clearance from them stating it is okay for you to have surgery. We want to make sure medical conditions are stable and well controlled prior to elective surgery. Please bring an updated and accurate list of medications you take to this appointment. This includes any vitamins, supplements, and over-the-counter medications. The nurse practitioner will review which medications are safe to take prior to surgery. They will go over eating and drinking instructions for the night before surgery, as well as instructions for an antimicrobial soap and nasal ointment for you to use prior to surgery. They will also review with you where to check in day of surgery. The following will discuss what to expect the day of surgery. The following items should be brought when you come to the hospital: a photo ID and insurance card. You should pack loose, comfortable clothing. Oftentimes, patients wear the same outfit they wore coming into the hospital, home when discharged. You should expect some swelling and discomfort after surgery. Loose clothing, particularly those with elastic waistbands, will help with dressing after surgery. Bring sneakers or other rubber-soled shoes. If applicable, bring a labeled case for your eyeglasses, contacts, hearing aids, or dentures. If you use a breathing machine for sleeping, called a CPAP, bring this as well. The hospital carries basic toiletries. These include shampoo, soap, comb, toothbrush, toothpaste, and deodorant. However, if you have a particular toiletry item that is within reason, you may bring that as well. The following are items you should avoid bringing with you to the hospital. Please leave all valuables at home. This includes all jewelry and wedding bands. They are not allowed in the operating room. Please remove any and all body piercings. Please leave any cash, credit cards, or checkbooks at home, unless you know you will need one of these for any co-payments. If this applies, only bring what you need to cover any co-payments. Please leave all medications at home. If you are unsure if the hospital carries a particular medication, you can call the office and check prior to your surgery date. If you are told to bring a particular medication to the hospital, please be sure to do so in its original medication bottle from the pharmacy. You will receive a phone call from our office the day before your surgery in the afternoon. During this call, we will give you your surgical check-in time and where to go. Check-in time is 2 hours before your surgery start time. The surgical check-in is located in the atrium building on the 5th floor. Using the elevators in the atrium building, you will see the check-in area as soon as you come out of the elevators. Please ask a hospital employee for assistance if you are unsure of where to go. Once you have completed your admission paperwork, you will be taken to the pre-operative holding area. Here you will change out of your clothes into a patient gown. Your vital signs will be taken. An IV or intravenous line will be inserted into your vein. You will be given fluids and medications through this line. For quality and safety practices, your surgical site will be verified, likely more than once, by members of the surgical team. Anesthesia will meet with you to review and confirm the type of anesthesia you will receive. Feelings of nervousness and anxiety can surface during this time. Please ask any questions you may have prior to surgery. Share with us how you are feeling. We want to minimize these feelings and make you as comfortable as we can. Here is a picture of what the pre-operative area looks like. If there is a family member or friend who will be waiting in the hospital during your surgery, please let the staff know when you are checking in. We have a patient tracking system where this person can track your progress. They will be given a non-identifiable number for them to check with the corresponding screen. These screens are located throughout the hospital. In particular, the 3rd floor of the atrium building, 5th floor of the south building, as well as in the floating hospital waiting areas. Shown here is a picture of what the patient tracking screen looks like. The non-identifiable number is color-coded to reflect the patient's location throughout the surgical process. This is a view of the family waiting area located on the 6th floor of the floating building. Joint replacement surgery can take between 2 and 3 hours. The hip is known as a ball and socket joint. It is formed when the thigh bone or femur joins the pelvis. The ball, or femoral head, is the head of the femur bone. The socket represents the acetabulum in which the femoral head sits. The hip on the left shows an arthritic hip. The hip on the right is what it looks like after hip replacement surgery. In a total hip replacement, the damaged bone and cartilage is removed and replaced with prosthetic components. An incision is made and begins the surgical process to expose the hip socket. The damaged femoral head is removed. It is replaced with a metal stem that is placed into the hollow center of the femur. A ceramic ball is placed on the upper part of the stem. This ball replaces the damaged femoral head that was removed. Next, the damaged cartilage surface of the acetabulum is removed and replaced with a metal socket. Screws or cement are sometimes used to hold the socket in place. A plastic spacer is inserted between the new ball and socket to allow for a smooth, gliding surface. The knee is known as a hinge joint. It is formed when the end of the thigh bone or femur meets the shin bone or tibia. It allows the leg to bend and straighten. The knee on the left shows a normal-looking knee. The knee on the right is a knee after replacement surgery. In a total knee replacement, an incision is made and begins the surgical process to expose the knee joint. The damaged cartilage surfaces at the ends of the femur and tibia are removed along with a small amount of underlying bone. The removed cartilage and bone are replaced with the metal components that recreate the surface of the joint. The undersurface of the patella, known as the kneecap, might be resurfaced if needed as well. A plastic spacer is inserted between the metal components to create a smooth, gliding surface. When surgery is completed in the operating room, you will be transferred to the Post-Anesthesia Care Unit, or PACU. It is also known as the recovery room. Here you are monitored closely as you recover from anesthesia. A nurse will frequently check your vital signs, such as temperature, blood pressure, heart rate, respiratory rate, and oxygen level. You may be wearing an oxygen mask or tubing at first. You will be asked several questions to find out how alert you are and how you are feeling. Being monitored in the recovery room is a critical phase in the patient's recovery. We ask that any visitors kindly wait until you are transferred to the inpatient unit before visiting with you. The following will go over what to expect in the post-operative course. Your inpatient team is comprised of healthcare providers across many disciplines who come together to assist in your recovery. Your team will consist of your surgeon and surgical residents, as well as a dedicated orthopedic inpatient physician assistant. You will be cared for by registered nurses and clinical care technicians. You will meet with the case manager to discuss your discharge plan. Physical therapy and occupational therapy will work with you to walk safely and review exercises. The majority of joint replacement patients will be transferred from the recovery room to the inpatient unit where you will stay until hospital discharge. These rooms are semi-private, often with other patients who have had orthopedic surgery. Your nurse will work closely with you as you recover from surgery, checking your vital signs and assessing your dressing. An individualized care plan is developed based on your needs as well as anticipated goals after joint replacement surgery. Your nurse will administer medications, those you may have been taking at home as well as other medications to assist with healing after surgery. You will be encouraged and taught how to do deep breathing exercises. An incentive spirometer, shown here, helps to keep your lungs clear. You may also have other access lines and monitoring devices. Your nurse will monitor these lines and devices closely and remove them when it is safe to do so. While your body is healing after surgery, we anticipate that you will experience pain or discomfort. Proper pain control is needed to help you walk, eat, sleep, and aid in your recovery. We also understand that pain is a personal experience, and no two people experience pain in the same manner. A pain-managed plan is designed specifically to your needs. We will work with you to keep you as comfortable as possible so that you are able to participate in your recovery. Here is a visual of the 0 to 10 pain scale used to assess your pain. 0 being no pain at all, and 10 being the worst pain ever. Our goal is to have you rate your pain at a 4 or less. We want you to be able to participate in your recovery. Discuss what is working and not working with your team. Pain is managed in a variety of ways. Non-narcotic medication can be given for mild to moderate pain. In cases of severe pain, opioid medication may be given. You will be monitored closely to make sure you are tolerating this medication safely. Please note, opioid medication can cause the following side effects: nausea, vomiting, constipation, itchiness, and urinary retention. If you experience any of these symptoms, please let your healthcare team know. A multimodal approach is used in conjunction with medications to ease postoperative pain. Ice can be beneficial to decrease swelling and pain. Frequent repositioning may lessen stiffness. Relaxation techniques can help calm and soothe one's state of mind. Undergoing joint replacement surgery puts one at a higher risk for falls. Factors that can increase one's risk for falling include the following: being in unfamiliar surroundings, taking medications that make you drowsy or disoriented, overall feeling weak, being connected to IVs or other equipment that make movement difficult. The following are some of the ways to decrease the risk of falling after surgery. Always ask a healthcare team member for assistance when getting out of bed. Sit at the edge of the bed for a few minutes before getting up to avoid dizziness. Wear non-skid footwear. If applicable, use hearing aids and/or glasses. Use the appropriate assistive device when walking, such as a walker or crutches. Try to anticipate your needs beforehand to avoid feeling rushed. Have your call button, telephone, and other personal items near you. Report any spills or objects that are on the floor. Always remember, call, don't fall. Physical therapy and occupational therapy will discuss rehabilitation after surgery.
For those of you who are having a total hip replacement, we have precautions for you to prevent dislocation of the new joint. We want you to avoid extreme range of motion. While you're here in the hospital with us, we will discuss certain activities that you should avoid doing during your recovery process. For those of you with a total knee replacement, your primary precaution is to not place anything under the knee. This includes pillows. Placing anything under your knee will prevent full straightening while healing. For your physical therapy visits, we're going to focus on strengthening and functional mobility. That includes walking, transfers, which are sitting and standing, bed mobility, your exercise program, and range of motion. Your first visit may be on the day of surgery. Otherwise, you will be seen the day after your surgery in the morning. We will conduct an initial interview to establish a baseline prior level of function and home setup and supports. This includes how many stairs do you have? What type of bed do you have? Do you have railings on your stairs? Do you use an assistive device right now, such as a cane or a walker? For your physical therapy progression while you're here in the hospital with us, you will be seen by PT twice a day, once in the morning and once in the afternoon. We will build on the exercise program that we provided you. We will progress your mobility and assistive device training, and we'll review and reinforce your precautions to make sure you're maintaining them at all times. Our goal is to have you safely do as much as you are able to while you're here with us. Outside of your therapy sessions, your homework is to walk with the nursing staff. This includes the nurses and the clinical care technicians. We recommend that you're out of bed and the chair, particularly for all meals, but you can get out of bed to the chair at any point in the day that you choose.
Occupational therapy will address your activities of everyday living, including dressing, toileting, how you shower or bathe, and how you will retrieve food or beverages. You will receive occupational therapy services the day of surgery, depending on how early your surgery was completed. Otherwise, you will be seen the next day. We will conduct an initial evaluation to determine what you are able to do or not able to do before surgery. We will ask questions about your home setup, who you live with, do you have pets to care for, what your social supports are, type of shower system you have, and equipment you may already have for your daily activities. Occupational therapy will continue daily living activities and adaptive equipment training. Adaptive equipment examples are a shower chair for use in a tub or shower stall, dressing equipment including sock aid, reacher, dressing stick, and long-handled shoehorn. There is also an option to have a 3-in-1 commode that can be used next to your bed or over an existing toilet, and lastly may be used in a shower depending on the space you have. How to prepare your home. Remove any clutter, cords, and throw rugs as they can be tripping hazards. Prepare frozen meals to reduce standing time to cook. Place commonly used items at waist height to prevent overreaching. Reinforce rails on stairs, and pack loose-fitting clothes and comfortable walking shoes for hospital stay and for your discharge. After your occupational therapy eval and treatment, we can determine whether you will need to have assistance for safe discharge or if you may need rehab to continue further occupational therapy and physical therapy services.
Welcome to Tufts Medical Center Joint Workshop. Case management is an important part of your upcoming surgery. Upon admission to the hospital, the nurse case manager on North Floor will make a visit to you and your family if they are present. As a case manager, we will provide the best discharge plan possible. Case management is responsible for continuum of care from admission through discharge to home or rehab. Prior to your admission, you will meet with your nurse navigator in the orthopedic clinic, who will ask you information regarding your social environment. I would like to emphasize that you contact your insurance to find out what your benefits are prior to your surgery. Our goal is to provide a smooth, worry-free stay here at Tufts Medical Center. You're going to talk to your case manager and you're going to discuss your home support network, having family friends to help you at home, your living situation, home equipment needs, discharge, rehab versus home, and also your insurance approvals. Again, we recommend calling your insurance company to discuss your short-term rehab benefits and VNA services. You may also go on this website to check your skilled nursing facilities in your area. You can search www.massgov tufsmedicalcenter.org. We're going to discuss your discharge. The typical length of stay. Generally, your length of stay at Tufts Medical Center is 1 to 2 days after surgery and depends on medical clearance, your type of surgery, your current level of function, and ability to demonstrate safety and mobility. Discharge at the end of your stay will be either your home with VNA services or short-term rehab. When discharging from Tufts, if you're going to go home, final equipment needs will be addressed at Tufts Medical Center. VNA, physical therapy, occupational therapy for home will be arranged at that time. We will review precautions, exercises, walking, level, and stairs. If you're going to rehab, equipment and home services will be set up by your rehabilitation facility team upon your discharge from that facility. Plan for your discharge to be between 9 a.m. and 10 a.m. Please keep your doctors, physician assistant, and nurses updated on your discharge ride arrangements. Plan to have someone, a relative or friend, come and drive you home. Plan for a responsible adult to help you the first 2 to 3 days for your return home from the hospital.
Hi, I'm the clinical instructor from North 4, where you'll be coming to recover after your surgery. Your nurse will review your discharge plan with you prior to discharge. She'll review your medications with you. Feel free to ask questions on anything you're concerned about. She'll also go over home PT, OT, and VNA services. The information for this will be on your discharge paperwork with a phone number for you to reach and the name of the VNA that you will be using at home. Your nurse will give you instructions on when to call the doctor and who best to call if you have concerns or issues. She'll go over teaching with you, and if you want a caregiver or someone present at the time of discharge instructions, just let her know and we can arrange to do the teaching when they arrive. You'll go home with compression stockings. You'll have either knee-high or thigh-high stockings depending on the surgery you had done. You want to make sure you remove these stockings at least once a day to check the skin for redness or signs of infection or irritation. We recommend taking them off at night and rinsing them out and putting them on in the morning before you get up for the day. Your incision care is going to be an Aquacel dressing, and we'll review signs of infection and things that you should be looking for when you're discharged. Your nurse will review infection prevention with you at the time of discharge and throughout your stay. A sterile dressing will be applied at the time of surgery. There's an Aquacel dressing that is able to wick moisture away from your wound and keep it dry. You want to avoid touching the wound, and you want to keep the incision clean and dry. Your dressing is going to help you to do that. Make sure to wash and dry your hands before touching the dressing or the skin around it. If your dressing comes loose, you want to contact the visiting nurse. You want to monitor your incision for redness, swelling, or drainage. Yourself for fever, chills, and pain. In terms of redness or swelling, you want to be paying attention for some warmth around that dressing, and if you notice any redness, you want to give the doctor a call. We've created a stoplight to help you decide who and when to call if you are having any concerns or issues at home. So the green light is you're doing great. Your incision is clean and dry, your pain is well controlled by medication, the swelling improves with rest, ice, compression, and elevation, you have no fever or chills. Continue what you're doing great. Yellow is called the doctor's office. Your incision is draining fluid, your fever is greater than 100.4, you have increasing pain with activity and rest, you have chills, a cough, or feel weak or achy, the swelling is worsening, feels warm to the touch, you have trouble urinating or are passing little to no urine, there's an inability to have a bowel movement or pass gas for 5 days. These are reasons to call the doctor's office during 9 to 5 hours. Red is seek care immediately. You have chest pain or shortness of breath. Your wound opens up. You've not urinated in 8 to 10 hours or longer, or your fever is greater than 102.4.
Thank you for taking the time to watch this video. We hope this video was helpful and that you feel prepared prior to your joint replacement surgery. If you have any questions, please do not hesitate to call. Thank you again, and we look forward to seeing you soon.